name is Azhane Williams. I am a part of the prevention services team here at SouthLight. My position is the prevention coordinator, and I also serve as an instructor for the ACE 1 program. So ACE is Alternative Counseling Education. We are a 3-week after-school program, and we work with the Wake County Public Schools to reduce long-term suspensions for students who have either brought drugs or alcohol onto the campus. Our program focuses on preventative measures, so we try to give students healthy alternatives, talk about things that they can do aside from using drugs or alcohol while they are still in school as well. We touch on how drugs and alcohol can affect our brains and bodies as we are still developing. And then we touch on consequences of our actions, following our peers, decision making, and communicating effectively. Normally after either registering for our program or enrolling in our program, parents are asking for other services that we have available at SouthLight. They're asking if we have counseling available, if they have family counseling that's available, and what are some other resources that we can keep students on the same track. So students can only be referred to our program through Wake County Public Schools. We do not take parental referrals or just walk-ins. So normally when students start our program, they're like dreading it. They're like, I don't want to be here. It's 3 hours out of my day. But once we start talking and they realize that this class is more so what they want, what they do, and why they do the things that they do, they kind of get a little more relaxed. So once they are a little more relaxed, they start to be a little more open. You get a little more truth out of them once they start to see that you're not a stickler. This is not just a structured, strict program, and you can actually have a conversation with your instructors. I like that every day is not the same. When you're working with students, they're not going to have the same attitudes that they did the week before. Your groups are not going to always be the same. You realize that you touch a lot more students than you realize just based off of you talking to them about drugs and alcohol. So just to know that I'm making a difference. I tell my students all the time, if I could just get through to at least one of you, I'm satisfied. One piece of advice that I would give to parents is to talk to their children. When I say talk to their children, I mean talk about their feelings, things that are kind of uncomfortable to talk about, things that they may be going through at school. Because when I see these students at school, they talk about how they are very quiet in their homes. They don't talk about their feelings. They suppress their feelings. I try to get students to understand it's not always the healthiest option. I get it. You may not want to talk to your parents all the time, but just by parents showing that they care and that they want to know what's going on in their kids' lives, that works. One mistake does not mean that is going to continue to happen throughout their entire high school career or their entire time being in middle school. One mistake doesn't define the student. Yes, you don't want to talk at the student. You want to let the student know that although you are in an authoritative position, that you hear them. Something that triggers our students, you got yourself here. They don't like to hear that. Yeah. But it's reality. You did get yourself here, but you don't have to constantly remind them of their mistake that they made. Granted, they made a mistake, and now this is their consequence for their mistake. And so once we get them past, or once they understand that this was a mistake and now you have to pay for your consequences or deal with the consequences, you don't want to continue to bring that up. Let the student move past that so that they're not reliving that suspension or that long term, or they're not reminded that they have to do the ACE program in order for them to stay in school.